that's going on in the classroom. So if we can elevate ourselves as professionals and know that we are providing the data and we have thought through these situations, then we probably can not be as defensive and not take things as personally, which I have found with many of my teachers is something that sometimes even prohibits them from having the conversation in the first place. I also think that it's really important to learn to stay centered, because sometimes if we're not centered going into a conversation and we're really nervous, we can be caught off guard and we can get defensive really easily. And if we can stay true to our purpose and the goals of our conversation, we'll be able to have a more productive outcome with our families. Remember how you felt when you weren't supported. And I would bet that part of you felt a little bit out of control because that emotion came out, either the anger or the frustration or whatever it was. So we can think ahead of time, what is going to be my tone with the families? How am I going to center and show them that I really care about them, I really care about their child, and I care about their child as a member of our learning community in our school, in our classroom. And how will we center enough to say, although I might feel frustrated at times, I'm going to really work hard at not letting that come through. I don't want one single word of frustration or judgment or anger to come through, even though certain days I might feel that way. I have to remember that as a professional, I need to go into that conversation and be in charge of myself, because if I'm centered and I'm in charge of myself, then I will be able to help the families on the other side of the conversation. And the majority of the work in any conflict conversation is work that we do on ourselves. So no matter how well the conversation begins, we need to stay in charge of ourselves and stay true to our purpose. And I can't overemphasize that enough. We had a new teacher have a difficult conversation 2 weeks ago, and that teacher was nervous, beyond nervous, of being in a room alone with these parents for the first time. And we worked really hard in helping her prepare to stay centered and to keep going back to the purpose of the meeting, which we had her write down and state over and over again. So it became a little bit of muscle memory, and she could feel confident that she knew why she was there and she wasn't going to allow herself to get derailed. So the next phase I call setting the stage. It's during the conversation. Really important is the environment in which we have the conversation. Please, please, please always have it in a private space. And hopefully it will be in a space where you're not going to be interrupted. It's really important that if you can, to welcome parents by offering them water, offering them coffee, giving them a comfortable place to sit. And sometimes if you think that the conversation is going to be emotional, make sure you have a box of tissues nearby. We want to make sure that the minute they walk in, we set the tone for this meeting. A really warm, firm handshake, a statement that says that we thank them for coming together. We thank you for taking the time to have this meeting with us. We hope that it's going to be really productive, but you want to let them know right off the bat that you're really glad that they're there and you welcome them. It's really important. And we also want to present an agenda. It doesn't have to be an agenda, in my opinion, in the traditional sense. It doesn't have to be a written agenda. But sometimes I found it interesting and important to let parents know in the first few moments what's going to be happening. It sort of takes the mystery out of the rest of the meeting, because sometimes they walk in and, let's face it, they have been reading things on the internet. They have been talking to their friends. They might have gone to their pediatrician. They have so much information and they don't know what to expect in this meeting. So if we say, we're glad that you're here. We're going to take a few minutes to explain some of the things that we've been seeing in school. Then we'd like to hear from you and understand how your child is acting, or what the challenges might be, or what the behaviors might be in other settings. And then we're going to sit and discuss some strategies together. And at the end of this, my intention is to have a plan. So in those few little phrases, you're taking the mystery out of the meeting and you're letting them know what to expect. And I can tell you from personal experience that I've been in meetings where I've done that, and all of a sudden the parents that are leaning in and like looking at you, all of a sudden relax. They're like, okay, now we know what's going to happen. We're good, right? So we want to try to do that. We want to always have an opening statement and a goal. We're here today to continue to work on ways to help Matthew express his frustration in more appropriate ways with his friends, right? That is our opening statement. That is our goal. That is our truth. That's what we're here for. We're not here to diagnose anyone. We're not here to say your child needs a therapist, because that's not our role, and especially not in the first meeting. There may be subsequent meetings where we have to get more granular and provide more resources and speak more clinically about a child. But in this opening difficult meeting, I'm using this as a way in. So for this presentation, and actually there will be other presentations, I think the next Sheva talk that Mark referred to, our colleagues from Chicago, one in particular, will be presenting more information. I think that will be helpful on that next level of conversation. But state the goal and keep coming back to the goal and know the goal. And let parents sort of understand the goal from your perspective. We're going to present our data and observations without any judgment, without any diagnosis, and making sure that we are just presenting what we have seen, what we have noticed. You might even use words like, we often notice that, we've wondered about, or we've seen, because we want to present what we've seen, not what we're speculating about. An example of that is, a speculation would be, Ben has anxiety. Well, I would rather we say in the first meeting, you know, we've noticed that Ben is often asking what's in his lunchbox and where his lunchbox is. And although we've showed him that it's in his backpack, he repeatedly does that throughout the morning, right? So there's this repetitive behavior happening. But you're not just coming out and saying, we think Ben is anxious, right? So we're just presenting what we see. We want to present affirmatives, what the child is doing, not what the child is not doing right away. And we also want to focus on the behaviors, not focus on the child. If a child is upset, we might want to say something like, Molly seems upset when she knocks over the blocks in the block area, not Molly is an angry child. We want to talk about the behaviors that we're seeing as opposed to labeling the child or the individual. And it's also really important to meet parents where they are. As I said a few minutes ago, they've been talking about and doing a lot of reading and a lot of speculating before they even walk in the door. And they may not even be in agreement with each other. So it's really important to keep in mind that we need to find out where they are and we need to meet them where they are. And the way we do that is by sitting back and listening. I could argue that one of the most passed over seemingly non-important skills is actually one of the most important skills, and that is being an active listener. When you listen, I would recommend, if you're taking notes, let parents know, hey, I hope you don't mind that I'm going to write a few things down so that when we get to the planning phase, I remember some of the things that you're saying to me. It also shows parents honor. It honors their ideas and their perspective if we sit and listen to them quietly. And listening to them is not volleying the information back and forth. It's really quietly listening and allowing them to share their perspectives with you based on what you just said to them in the opening. After we listen, we will undoubtedly have more information, and we will know more about this child and this family than we could have even imagined. But that requires careful listening, and it requires holding yourself back and resisting the urge to answer when they are saying something. And this is a skill and an art that comes over time. I would say that if you are using some of these tools and going into a conversation like this next week, the listening part will be difficult for sure, but it is an acquired skill, and it's something that over time, I think becomes an easier thing to be able to do. And then you're going to end the during part by coming up with a few strategies and making a plan. I think first it's a good idea, before you strategize, to restate the parent's perspective or restate their concern. I heard you say that one of the things that you're really concerned about is when your child is at a birthday party and often pushes other children. I also heard you say, and on and on and on. And bring them back to the goal and to the intention that you stated right at the beginning. And you might even want to ask them to restate what they heard you say. So this is a part where you can truly, truly come together. You can ask them if they understood your goal. You can ask them if they understood and if they felt like you were accurately portraying what could be going on. And you can initiate some conversation before you get to the strategy. And the strategy is really just agreeing upon a few things that you might be able to tweak or change. And it might even, excuse me, include agreeing on how you're going to communicate post this conversation. So when Ben walks into the classroom tomorrow, we're going to make sure that we remind him that pushing his friends is not part of what we do in our classroom family, and we're going to give him frequent reminders. And we are going to help him to understand this is where he is going to go, this is where he's going to sit, you know, whatever you decide. Every situation is so different. And then I'm going to let you know how it's going after a day or two. I'm going to let you know what I'm seeing. And that's really important, because not only is the plan the strategy that you might be suggesting, or maybe a strategy that the parents think might be helpful, or a combination thereof, but part of the plan is the communication. And I would say that if the meeting goes well and you're making the plan and you're about ready to wrap up, review the strategies, write them down, or review the 2 or 3 points, write them down, and let them know that you're going to be communicating with them based on what you have decided together. So I wanted to show you this slide because I've used it for years. When I was doing some reading on this topic, I was really surprised to see this, and it's what gave me the opportunity to pause and think about active listening. This is what research has shown a normal, difficult conversation looks like and should look like. So when you're the initiator of the conversation, your opening or your airtime is really a short period of time, but look how long the active listening is. And look how long the other party's airtime is. And then if all that goes well, the joint problem solving and the making of the plan, in this case, they call it obtaining a commitment, is really just as succinct maybe as the opening. And it's important because in reading about these kinds of conversations, it's really cathartic for people to share their perspective. And in the case of parents who are worried and concerned and undoubtedly emotional and a whole bunch of other things that we all know about, letting them have the opportunity to say what they need to say is important. The big thing that prohibits many people from even dipping their toe into the water and considering having these conversations is that they worry about what happens if this conversation gets ugly? What happens if it derails? What happens if people cry and scream and point fingers at each other? And after working with my teachers for many years on this, I've learned that this is one of their biggest fears. That what's going to happen, Robin, when that parent really lets loose and starts screaming and ranting and raving? Well, that's always a possibility. And even if you are as well prepared as you could be and have the best of intentions and have centered yourself and done all the breathing exercises that you could possibly do and meditated for 60 hours, it might be that the conversation derails. So a few words about that. It could be that parents start to disagree with each other. It could be that they insist that you're not seeing things correctly. It could be that they are looking to place blame. And it could be that they're just emotional and sad that they're even having this conversation. The biggest thing that I have found helpful is in those moments to not get flustered and to acknowledge how they're feeling. I know this must be sad for you. I know this must be difficult for you. I'm sure that hearing what I've had to say and sharing what you've shared is a bit uncomfortable. But then you need to go back to that support, that feeling that you felt in your interaction that you described not too long ago. When you felt supported, things were different. So you need to, at that moment, and if nothing else sticks about the conversation derailing, please remember this. Remind parents that you are with them, that you are there sharing with them, that you want to work with them, that you want this to be the best experience possible for their child, and that's why you're having the conversation. There may be things or parts of the conversation that you can't anticipate, but I always feel as though if you elevate yourself to the professional role and take the personal out of it, again, teachers as professionals have seen this many, many, many times perhaps, but these parents are seeing it for the first time. So it's our responsibility to wrap our arms around them and to help them to feel supported and to help them feel that we're there and to let them know that our intentions are true and our intentions are real and our intentions are because we care about their child. And so what happens if you do all that and there's still a lot of emotion and there's a lot of screaming and there's crying? You can take a break. You could suggest a 10-minute break. Hey, should we take a little break just to calm down? You can agree to meet again in 3 days. You can say, would it be easier if we follow up and have a phone call tomorrow? Because I see that this is difficult. Whatever you need to do to show them respect, but also stay emotionally in charge for yourself and stay centered and let them know that you are in charge in that way. Does that make any sense? Because these are situations where, quite honestly, it's really hard to anticipate anything and everything that could happen. After this is all done, I call this linking arms and working together. So it's important that the first communication, the follow-up, is within 24 hours of the conversation, whether it's an email, a phone call, a quick conversation in person. Thank you again for coming in. That was a great conversation that we had, and I know that we have a good plan and that we're going to work well together, or I know that we're going to be able to make steps to help your child. Whatever it is you need to say, that communication can't wait a week, because it shows parents that you really, really mean what you said, and that you really do care, and that you really are watching, and that you are really attentive, and that you are really supporting. It's important to regularly share the progress and the challenges. If things are going well, share. Hey, we tried that strategy, and guess what? I thought it went really well today. I'm hopeful it's going to go well tomorrow too. Or guess what? It didn't go so well today. We're going to try again tomorrow, and we'll let you know, but keep in constant communication. Please continue to observe and document and collect the data, because we found many times that in conversations such as these, it's likely that you're going to have another conversation. This is dynamic. This is not a one and done fix for a situation. This is the start of building a deeper relationship, because it's so critical to the child's experience in school. And as I said before, please consider meeting again a month after, 5 weeks after, 3 weeks after, whenever you think is appropriate, and set new goals, especially if you're having some success and you see some progress and you can really look to go to the next level, whatever that next level is. Since I am a visual learner, it's always important for me to keep this visual in my mind, knowing that anytime I'm approaching something that is going to be challenging or crucial or difficult or uncomfortable, that I want to know that I am preparing for these 3 steps. And I'm hoping that with some of the tools that I suggested, both from my experience, the experience of my teachers, and also from doing some research throughout the years, that perhaps you feel as though when you go into your next conversation that's a little bit difficult, you feel better prepared. This is a skill that takes time. This is a skill that is honed over time. And with each experience, it does get easier. The teacher that I told you about that prepared for a difficult conversation a few weeks ago let me know that after the conversation and after it went really well and after she felt very prepared and centered, that she knew she could do it again, and that she knew the next time it would be easier. And what I know after having probably hundreds of these conversations is that it does get easier, and you do tend to go to some of the same strategies around opening and what to say and how to show support and all the things that we talked about. And it's important for you, I think, to take a moment to reflect and to answer some questions before you go into your next difficult conversation, making sure that you are really clear about your purpose and your intentions, and any anger, frustration, judgment goes out the window, and that you stay true to what you need to do as the advocate for that child's learning. Please make sure you will be able to support the parents and that you want to support the parents and that it's intentional. When you do support the parents, they will feel it just the way you felt supported. Your emotional state, please make sure that you're able to center. I would not recommend having a difficult conversation when you're having a difficult time in your life and you can't have the clarity to be able to go into that conversation with some emotional strength. And please try to commit to active listening. Not easy, but I promise if you really think about it, you can do it. And it gets easier every time and you can listen longer every time. You will find out so much when you listen. Make sure that you will be able to have a clear plan, that when all is said and done, there is something put in place so that everyone knows what the next steps are and when you will follow up. And that, again, has to happen pretty quickly after this kind of conversation. So I am back to not screen sharing. And my hope is that in our time together, I've been able to share with you some of the strategies that I've found extremely helpful. I wanted to let you know that besides experience, there are a lot of great resources out there. There are some excellent books on having crucial conversations. There are some articles and studies that I've had Mackenzie put up on jcca.me. My PowerPoint will be going up there as well. And as with anything else we do, it's important that we move into the idea of creating relationships with our families by being intentional about them and by always being supportive on behalf of the children.
Thank you, Robin. Before we have a few minutes here. If you have any questions or thoughts or something you want to say, just unmute yourself or wave or ask, because this is a golden opportunity if you'd like to do that before we end and make a few announcements. Anybody have something they want to ask or ask Robin?
I do, actually. It's Pam, Robin.
Hi, Pam.
Hartford. Hi.
Hi, Pam.
Hi. So, you know, I hear and I can tell that you are, you know, work very hard at this, and, you know, you have a very clear understanding of it. And what if you're in a meeting with a parent and a teacher, and the teacher part of it's not going so great with them? Where do you put yourself? I think that's something, you know, I mean, this is a very big topic, and I, you know, I, even as I'm asking, I'm thinking I'm not looking for other than, you know, it can be, I find that very difficult, because you almost want to reach out and put your hand on them, which I have done, and just say, you know, let's look at this in another way, or, you know, try to redirect it to the parent, or, but sometimes that's where the emotionality, you know, is very difficult to control, and you're seeing it go somewhere that you as a director or as a head teacher or whatever, you know, don't want it to be going.
Mm-hmm. So I just had a situation like that last week. So I can tell you what I did, but before I do that, I will tell you that I think the same preparation could and should be shared with the teacher prior to having the conversation, to make sure, at least, if nothing else, that the teacher's intentions and mindset in going into that conversation are aligned with yours. So if you sense that your teacher is frustrated, if you sense that your teacher is angry or is perhaps jumping to some conclusions or making some judgments, it's important to have that conversation with the teacher. Not that those feelings shouldn't be validated and should be unpacked, but in the context of the conversation, they're not helpful, right? So I had a conversation where a teacher and a parent got really, really angry at each other. And I went into the I went into the conversation knowing what my purpose was. And I stated my purpose at the beginning of the conversation, and that was to open the lines of communication and to make sure that we start sharing back and forth, because I believe, from my perspective, from where I sit talking to both of them, that there are communication missteps that are happening. And so I facilitated the conversation, but when it got really emotional, I said exactly this. I understand that this is a difficult conversation for you both to be having, and I understand that there are things that may have been said or perceived on both ends throughout the past several months. But remember, we're here to open the lines of communication. Right. So how can we do that?
Yeah.
And I gave them a few minutes to breathe. And the mother said, I'm sorry for being so emotional. And you're right, we have to move forward, which I didn't expect to happen. I think I got a little bit lucky, because I might have had to restate that a few times and bring them back. Right. Or I might have had to say, you know what? Right now, this conversation is not really that productive. So maybe we ought to take a few minutes. But I can't overemphasize that this skill is not just a skill for directors, it's a skill for teachers.
Yeah.
And so the idea of reflecting before you go into that conversation, the teacher that I talked about, the new teacher, actually did some practice conversations with my mentor teacher before she went in to have her conversation. And I would recommend doing that. And if anybody wants to know what that looks like, I'm happy to Zoom with you privately and we could have a mock conversation. I think it helps at least establish the rhythm for the conversation and the meaning of what needs to come into the conversation and also what needs to stay out.
Yeah.
Thank you, Robin. That was just a beautiful answer. I want to just tell you all another advantage of being here on the screen and meeting Robin is that, of course, according to her schedule, you can request an opportunity to meet with her privately on Zoom at any point. Your directors will know how to do that. It comes through our website, and she's assuming she can have the time and find it. That's something that's available as well. And I want to thank Robin for just such an enlightening and helpful and practical opportunity for us to share. And I would hope that those of you who are directors and have a few teachers or no teachers or some teachers, that you would at least share what you learned today so that, as Robin said, this is really not a director thing. This is the thing for anybody who's working with our families and an opportunity. So Robin, thank you. This was just so lovely. And I'm glad that the screen didn't blow up in any way this time. It must be my presence, of course, which is that.
Don't tell Kathy that.
I won't, because what you don't know is that we only got about 35 minutes of your recording because Michelle and I, which is why I kept disappearing, we're trying to figure out how to sign in because neither of us seemed to be down as the host. But I did eventually. I think it was dumb luck. But so we might just have you do it again. What can I tell you? And Robin did this not feeling well, as you can sort of tell. So thank you for that, too. I want to just announce to you that our next Educators Forum is on March 15th. You'll be getting information about it also at 12 and 3. And it's a very different topic. It's called Play Detective with Rachel Schwartz, who is the Social Services Director at our JCC in Chicago and an expert in special needs and inclusion. And the blurb she has in our flyer says, join us for an interactive discussion on uncovering the underlying meaning of children's challenging behaviors and establish effective and supportive strategies for responding to them. It's actually a perfect next step after you have the conversation with the families. We talk about what you can do about the challenging behaviors of the children. If you have any questions or you have anything you'd like to know or you can't find where the materials are posted, just holler at us and email us, and we'll do that as soon as we possibly can. So Robin, thank you one more time for a really beautiful afternoon.
Robin.
And we'll all see you again soon, I hope. So thank you. It's wonderful to see so many of you here. So
Hey,
take care.
Ryan, it's Debbie
And-
Shankin.
Thank you. Hi, Deb.
How are you?
I'm good. How are you?
Good. Thank you so much. I'm so glad I was able to listen to your presentation
Oh,
today.
me too. It's good to see you, Deb. I didn't have my glasses on, so you're. Wait, I'll put them on. There you are, Deb.
Thank you so much. This was really helpful, and I'll share it with as many as I can here.
Oh, I'm glad. I'm glad. It's great to see you. Say hi to everybody.
I will. Take care.
Thanks, everybody. I'm going
Bye.
to turn
Bye,
us all
Susan.
off. Thank you.